So, good afternoon. I guess good morning for you, Deanna. I'm so excited to be connecting with you today. And I'm just going to start, if that's okay, Deanna, with talking a little bit about your experience and background. And then we can sort of jump into the questions if you're okay with that, Deanna. Does that sound good to you?
Absolutely.
Fantastic. So I know how fabulous you are, but I want others to know the great experience that you have. So I know that Deanna has been practicing since 2006, and that, which is really cool, you're currently pursuing your doctorate in behavioral health at the Cummings Institute. Very exciting, and I can't wait to ask you more about that. That you have been working as a mental health professional in the government since 2017. That's how we connected, and I'm so glad that that happened. And you have a lot of really fabulous experience in addictions counseling in Eastside Vancouver. And I know that the areas that you really have been worked in the past, really passionate about, are working with families and individuals with behavioral and emotional regulation issues. So I know that's sort of just a brief look at all of the wonderful things you've been doing over the years. So I wanted to give people a little bit of the background, but now I'm really excited to uh, jump in and let folks know that in this episode, we're going to talk about your doctorate that you're working on now in behavioral sciences and just how this is going and how you're doing, all the cool things that you're learning, and how this is going to help you, but all the clients that you serve. And luckily for me, all the clients that we will collaborate and work with together at Healing Habit Psychotherapy. So I have a lot of questions. I always do. Deanna knows me really well. So enough of me talking. Let's jump in and dig into some of these questions. So, Deanna, I know that one of your passions, something that you're working on now in your doctorate, is your focus on research, right? That you want to make sure that everything's evidence-based, empirically validated, and how you can focus on that research and bring all of that into your day-to-day practice and collaboration with your clients. So, having said that, can you elaborate a little bit on the importance of researching interventions in mental health and diet, exercise, sleep, and stress management? And how do
Thank
you
you.
prioritize these? Because there's a lot, right? So how do you prioritize these?
Thank you so much for the beautiful introduction, Erin, and such an honor to be on this journey with you at Healing Habit Psychotherapy and being able to serve our community and provide our skills and support for them as they're trying to increase their health and well-being in life. I would say that with the research question, thank you so much for asking me that because it is one of the skills that I'm working hard to become even better at through this integrated behavioral health journey that I'm doing with the Cummings Institute. And it's really about knowing the interventions have something behind them in the scholarly writing, that they have evidence behind them, that they do support people in improvements. I think especially when people have chronic conditions and they're going to their health providers for support, sometimes they don't always know some of the lifestyle stuff that can support them in being able to sort of optimize their recovery and their health journey. And so having these skills as a behavioral health consultant allows me to be able to understand how to really dig into those scholarly writing and articles and pull out what we know and what we don't know. And I'm a big believer in admitting what I don't know. I'm a big believer in really understanding the gray areas. And I think that sometimes there's these messages that are very rigid that tell people this is the right way to do it or the wrong way to do it. And there's just so much information out there. It's incredibly confusing. And people can often feel, quite confused and despairing because they're trying so hard to improve their health and they just don't know what's real. And there's a lot of stuff that's marketed by someone with an interest, financially and otherwise, that's profiting off of that message or profiting off of that research. And so it looks like it's something that's real. But when you dig further into it, you find out that actually there isn't as much that supports that. And so I want to be someone that the public can trust when they're going through some of the hardest times in their life, that I'm going to say, this is what I know and don't know. This is what we know and don't know. And I tend to just love that. I love being an investigator. I'm so curious, and I've got that piece of my brain that really gets digging into something when I want to help someone and find those puzzle pieces of what we know and what we don't know, and just really help them feel informed about their own health and their own situation and the unique things that are related to what they're going through and what can be done to maximize the efforts for them to get better and feel good.
Yeah. Oh, what a great answer. And I know a very wise person, it was the way, said when people make sense when you have all the information, right? And so I love that focus on evidence-based, but with some flexibility too, some psychological flexibility and ethical. Awesome. Okay, I have another question. I have so many questions for you. You mentioned the pursuit of excellence, right, on feedback from those you serve. So could you share an example of how your client feedback has influenced the services you provide?
When I was working in addictions with Vancouver Coastal Health, one of the things that we used was the Scott Miller and Barry Duncan assessments, where the client would put like how they felt about, whether they were getting what they need in the counseling, and if they felt confident with what they were learning, that they would have skills and strategies to change and that they were actually getting somewhere. And I feel like sometimes when I meet with people, I know that we like each other and it's a nice interaction. We enjoy chatting, but I don't want it to just be a thought exercise. I really want them to have change at that body level, at that somatic level, and also, how they're processing and moving through their life mentally and emotionally. And so knowing that what we're doing is sticking with them and becoming a part of how they move through their day to have a better life and to, follow those routines and habits we're trying to help them make change with is super important to me. I'm not interested in people feeling really like they have put so much money and effort in for what? I really
Yeah.
don't, that doesn't feed my soul at all. I really want to see that when they come back to see me, the rubber's meeting the road, so to speak, that they're able to say, you know what? Deanna, this strategy stuck with me and I got some traction on it and I got some wins this week with the change. And if it didn't, that they feel very comfortable to be honest and say, I know you have a lot of tools doing, counseling therapy stuff for 19 years and you're learning all these behavioral strategies in your program to help me. And so I'm going to be honest, that one, it didn't resonate, with how I operate. It didn't stick with me. And okay, good. Thank you, please, because I want to be meaningful. So let's figure something else out and try a different avenue, a different strategy, a different plan, because I am not interested in contributing to people having more despair and circling the drain. I want them to be successful. And that is genuinely on my heart every day when I come to this work to be of service.
Well, this is a great segue to my next question about empowering clients. You just emphasized the importance of clients being, involved in the process. They're the experts on themselves, right? You've got all this great experience and education and training, which is wonderful. But again, I like how you really emphasized you don't live inside that person. They're the experts on themselves. How do you foster this sense of empowerment in your practice?
It's interesting to talk about because I know that for some of us, including myself, we feel pretty beaten down by some of the things in life where we've hit the wall of our resources to cope. And I think that when we do hit that wall of our resources to cope and we don't have the strategies we need, there can be a bit of learned helplessness where we feel like we're just in a boat in the storm and we're getting pushed and, pulled every direction. And we just don't feel like we have any say or control, and that these people outside of us are reading our situation and telling us what to do, and that we're trying, it's not working. And it's interesting, having done some work with people, functional rehabilitation work with Disability World, and with people in another clinic I work in for chronic obesity, where people really feel so judged that it's really that they just don't have what it takes, and getting their confidence back that they can make change and they can see change happen, and that they have a guidance system inside of them that wants them to be healthy is so powerful. Because sometimes they'll look at me and say, nobody's really heard me, but you're hearing me. And really, all I'm doing is mirroring to them what they're saying to me about the symptoms they're experiencing and the pain they're experiencing and how they're feeling. And even that space that we're holding together for them to be able to reflect on what's going on. It's this magical thing that happens that I just love, where I feel like the iceberg kind of dips a bit lower, where you see more in their subconscious for them because of that safety and because of that respect and regard for their system. Because as you said, I say this all the time, it's my one of my things is that we all make sense. And if we don't make sense, if someone doesn't make sense to me, I'm missing pieces in the puzzle of them, why they see the world the way they do. And if we can figure that out because they feel calm and safe enough that I'm there to help them, and that there is things within them that can be, sort of unfolding in that moment to show us what is going on. I feel like sometimes they'll say something to me like, well, I don't know if this matters, but, and then the thing that's coming up that they're not even sure if it's a thing could be a life-changing piece of the puzzle that we hadn't gotten to yet. And when that happens, it's such a powerful moment. Like, it just gives me like chills up the back of my neck, because that part of them and that iceberg that's dipping lower and letting them see some stuff that may be sort of subconscious in their operating system is giving us what we need because they're ready to move forward. And so knowing that this wisdom is in each individual about the microcosm that is them, their bio
Yeah.
individuality of their own body and what they need. And I was reading something the other day that I found so incredibly interesting. And it was talking about how, if a dog has a tummy issue where they've got like acid going on, they go and they eat grass and they know what to do to try and regulate themselves again. And I feel like as humans, because our brains are so complex, that sometimes, we're circling around in here and our brain is saying all these automatic things. But when we dive deeper and we connect deeper to what we really feel and need, because we feel safe and less in fight or flight. And so
Mhm.
the blood's moving in the brain and the body to be able to, rest and digest zone, that parasympathetic nervous system versus fight or flight, all the blood's out here. Something amazing starts to happen where people realize that they do have some guidance that they can trust that's going to help them figure out what they need. And I think that is so powerful. And I think that's far more powerful than anything that I can do. Sometimes I just need to help facilitate and then get out of the way.
Yep. Well, again, fabulous segue because, you've talked about, the power of empowering clients, right? With that in mind, how do you balance that with guiding your clients? So, in what ways do you guide your clients to make informed decisions about their health and well-being? So, maybe you can share with me some of the common factors that influence their choices.
And I love that you bring that up, because I know that a lot of people will say, I've done dog therapy and it just, talk and talk, it doesn't work. I've got more insight,
Yeah.
but nothing changed. And so there is really good, well-researched strategies that I can bring to the table. And so I really enjoy that piece for sure, of being able to say, hey, here's what we know. And here's some of the knowledge through the history in my field and through the studies and research and experiences and experimentation that's been done that works for what you're going through. And sometimes, that can be such a pivotal point. I had someone say to me the other day that when they were learning about certain things that they just didn't know about with their body, whether it was nutrition or, what happens with blood sugar with weightlifting and exercise to regulate insulin and blood sugar, they had this like aha moment where they started to go, that's why I feel this way. And that's why this happens when I'm doing this. And it tapped into that wisdom that they had, but it was through using these strategies that have been developed to help people with a plan and to help them to basically set up their environment for success, have a plan to decrease decision fatigue so that they know what they're going to be trialing in a very systematic way to see how it's going to work. And, I build on their strengths and I use their insights, but I very much believe that it's important to don't reinvent the wheel.
Yeah,
Use what's been created that works to help them make those changes.
fabulous. I love it. And my final question, I have so many questions for you, but I know we only have a certain amount of time. My final question for you, Deanna, is how do you integrate various aspects of health? Because there's so many that you've mentioned, like diet, exercise, sleep, and relationships, sort of into a holistic approach for your clients, right? Do you break it into small chunks or do you integrate it? I'm really curious to see how you do this or your vision for this.
Yeah, thank you, Erin, so much because sometimes a certain area is not on someone's radar, but
Mm,
it's that kind of hierarchy of needs. And when we look at starting with sleep
mm,
and having food throughout the day at the times that fuel your body, sort of like a gas tank that needs the fuel or it's not going to drive,
100%.
and stress management, these things kind of tie in together on that basic level of how they can move forward in using their body, their mind, and their heart for other changes.
Mm,
Because if we don't have the bandwidth because we're not sleeping at night, it's very hard to have impulse control to regulate what you're eating. And it's very hard to push yourself to go and do more activity when you're exhausted. And so being able to sort of start at that primary level of like, how are you feeling and working with this beautiful being that you have that's uniquely yours to meet those basics. And then let's go a little bit further because
hmm
sometimes the reason that the struggle is happening with the basics is something bigger,
hmm
like the stress in relationships or feeling really afraid of something that's unaddressed that needs to shift. And all of a sudden, the person is able to sleep. So I try to really listen because people will often, without even knowing they're doing it, have these little tells, and their partners and family will know their
Yeah.
tells when they're
hmm
overstressed and when things are out of alignment. And so I try to really tune into them and for their tells. And what are the tells that I'm noticing as to what is really hijacking their system?
Yeah.
And whatever is that pressing thing that they typically feel is most important to look at is a good starting point because oftentimes a person will know what they're really getting stuck in. And then bringing it deeper to what's happening for you as far as what you bring to the table to solve it, right? Like, do you have your basic stuff aligned to have yourself be able to think and learn and be able to sort of be regulated in the moment to moment? To be able to solve all those other things, and let's get you to the place where you've got optimal resources for your day.
Absolutely. Oh, Deanna, it's been such a pleasure chatting with you, doing a deeper dive on the things that are so important to you, not only in your doctorate work, your day-to-day practice, but just who you are as a human. So thank you for sharing this with me. I really appreciate it. And I look forward to this. I feel like this is just the beginning. I look forward to
Absolutely.
more conversations on this and many other topics to come.
And stay tuned, folks, because we're going to do a deep dive on Erin and what she's bringing to the practice. So I'm very excited for you to hear all the amazing things that she's going to be sharing with our community.